I specialize in upper limb problems, especially those that relate to shoulders and elbows. If you have a problem of the upper limb, then I'm the right guy for you. Although I'm an orthopedic surgeon, I only operate on about 20% of my cases. I don't have this tunnel vision that some surgeons may have, is that they see every patient as a potential operation. There are patients who have something broken, torn, and of course they need surgery. But most of my patients really require a diagnosis. If you want an answer for a shoulder and elbow problem or an upper limb problem, to see what's wrong with you and how best we can manage it, and consider all options, i.e. surgical and non-surgical options, then I'm the guy for you. Working at London Independent Hospital or doing orthopedic surgery is almost like Formula One, right? It's not just the driver that is important, it's the whole team. The best thing about the London Independent Hospital is the people that work here. And just like Formula One, everybody from the theatre staff to other clinicians and physicians, all the way down to the porters and the receptionists are all top class. And they work cohesively together to allow us to achieve great patient care.